Let's walk through the prioritization, at least for infectious disease control of airborne. And we should also talk about other control measures, but I'll just talk about the building part for right now. You want to bring in as much outdoor air as you can. Any air that's recirculated, most buildings recirculate a fraction of their air, should be run through a filter bank. Typically, these filters only capture a small percent of airborne particles. But if you go to a higher efficiency filter, it'll capture more of the airborne particles. And then you can supplement that if needed with things like a portable air cleaner or a portable air purifier in a room, in a small room. But the way to verify this is performing, again, is that technology side of this. So sure, you should hire a mechanical engineer to commission your system. Commissioning, if you're not familiar with it, is the process by which you verify your systems are performing like they should. Kind of like getting your car a tune-up. So you give your building a tune-up by hiring a commissioning agent. You can supplement that with real-time technology and sensors that will measure indicators of air quality. So you know in between the checkup, in between the tune-up, whether or not you have to call that person back to kind of fix the building again. So unfortunately, what we do, like I said, is we'll design a building and kind of forget about it. We hope it works the same for the next 5 or 10 years, and that's clearly not going to be the case.
And to the point about who would be responsible for making sure the tune-up is done, and who is responsible for making sure that they're looking at the information and ensuring that people's well-being is put first because the building is working effectively or is healthy, as we say.
Yeah, so to bring in the book again, we talk about something really quite important. As people are familiar kind of with green building rating systems, and now there are these healthy building rating systems. And my co-author and I argue that it's not so much the what of a certification, it's the who, to your point, exactly, Ewan. And we argue, it needs a different level of expertise because you need someone with a health expertise. Because if you get energy wrong in a building, okay, your energy calculation is off, not good for climate, but no one's really dying. If you mess up health in your building, the stakes are massive. So you need to bring in someone with expertise in assessing, controlling. I mentioned industrial hygiene in the beginning. This is the field. I'm certified industrial hygiene. I think you could look for someone with that credential who can assess, anticipate, and control hazards, and not just biological hazards, chemical hazards, radiological hazards, physical hazards. So it's a different kind of expertise, and it has to be taken seriously because the stakes are so high. These people, I often say the person who manages your building has a greater impact on your health than your doctor. That's like, what? Okay, for a lot of people, they're surprised to think about that. It's the absolute truth. And these people are making decisions about our buildings every single day that determine our health. And so we have to place a lot of care in those decisions.